So, very warm welcome to everybody. I'm really happy that you are on time. Thank you so much for that. We appreciate that. Today we are going to talk about the Culture and Health Platform as new initiatives titled Opportunities for Artists. My name is Kornelia Kiss. I'm head of Culture and Health at Culture Action Europe and leading the consortium of the Culture and Health Platform, which is consisting out of 15 organizations. This webinar will be helping you to understand what is coming up, especially in the first half a year of the platform's work. We will first talk about a little bit how the Culture and Health Platform came into being, give you a little bit of a reference of what how we got here and what we are planning and what are the actions of the platform. Then a placement opportunity in Bologna will be presented by Associazione Oltre, as well as an EU-wide call for capacity building by Red Noses International. I'd like to let you know that actually there are already quite many other calls are open as well, but this nationally, this will be presented later, but currently in the national level, we also have open calls for artists to implement projects in Italy, Netherlands, as well as Austria. But this webinar will be more talking about the EU-wide possibilities. You will also hear later about how you can understand more about the national calls. And after a bit of energizer, we will be turning to agenda point 4, which will be about a capacity building possibility of how to work in the health and the care environments. What are the insights of creative professionals who are working in healthcare? And here, Red Noses International will be very much helping us in this process. So now I will tell you a little bit about how the Culture and Health Platform came into being. This might be a little bit of a repetition for the ones who have been there at the platform launch in December, but nevertheless, I think it's still good to understand and have the full picture. So the whole idea of where the Culture and Health Platform comes from actually stems from the Culture for Health project, which have created quite many resources to build on. It was an EU preparatory action that meant that members of European Parliament have said that there should be work on the intersection of culture and health, and therefore one of the outcomes was the writing of the Culture for Health report, which has a shorter summary version as well as a longer version, which is putting together the evidence on how culture and cultural activities can have a beneficial contribution to health, as well as individual well-being, as well as societal well-being. Another key important document, of course, where we are coming from is the WHO 2019 report, dealing with what is the evidence on the role of arts in improving health and well-being, which you can find here. And we will be putting in the chat the links to these documents, which are also very helpful resources for you. The Culture for Health report also developed a specific publication on arts and health, supporting the mental well-being of forcibly displaced people. This was, of course, when the war on Ukraine came about, and we really felt the urgent need to put together a set of evidence and also recommendations of how psychosocial support could be using cultural activities to support the mental well-being of forcibly displaced people. I also invite you to look at the database of the Culture for Health project, which has collected more than 800 projects across the world, but mostly, of course, from Europe, working in the intersection on culture, health, and well-being. And I'd like to let you know that this database is not closed. You can always submit your projects, and after a certain time, it will be curated and added to the database. So we have committed also as part of the Culture and Health Platform, as well as the CARE project, to continue collecting these projects, because they give an excellent possibility both for practitioners who are, for example, interested in starting a project in a specific art field, for example, I don't know, singing. You can always search the database through who is the target group, what art form you are using, or also through open search possibilities, like, for example, if you are a municipality, what are the projects that has been happening in Europe organized by municipalities. And why it is useful is actually you don't have to reinvent the wheel. You can already start from a place, understanding what the other project has been doing, and therefore you can already start on a similar level, adopt it, of course, to your local circumstances, but it's still a good way to actually see what is already out there. I really invite you to take a look at that database. We also have, of course, gathered quite many experts, practitioners, and researchers around the Culture for Health project. So therefore, of course, I'm also always happy to help if you need some specific speakers in a specific field. There is quite a body of knowledge accumulated at Culture Action Europe and the other members of the Culture for Health project, which you can see here below in the slide. And another thing that might be useful, and we will be talking about this as well, is the Culture for Health and Wellbeing Compendium, a guide for practitioners, which actually aims to help artists who want to start working in this field of how to start, what are the best practices. So I'm going back to the Culture for Health report for a little while, which was led by Dr. Aritza Branca and others. And it actually has three parts. One of them is collecting the evidence, adding to the 2019 WHO report, which collected already 3,000 pieces of evidence on how arts contributes to health. But we have widened the scope, adding the culture's contribution to subjective well-being, as well as culture's contribution to community well-being. And here, if there is just one page you should take a look, is page 7, which actually shows a list of outcomes that cultural and artistic activities can have on people. And it's quite useful, I think, in putting together, for example, a project applications. But the next part is the policy recommendations part, which has been driving quite many things on EU level already. And I'm going to talk to you about that a little bit in the next slide, I think. And we also have seen that we need another way of talking to politicians. So we started from the challenge, actually, that politicians might have. Politicians and policymakers. So, for example, we have highlighted, like, if there is an aging of the population, that has, of course, a lot of implications for policymaking. And we have tried to show how culture and cultural activities can help decision makers in contributing to solve that challenge. Of course, we might not be able to solve it fully, but at least we can lighten, let's say, that challenge. So it's quite nicely structured, how we talk first about the challenge with a lot of data. Then we try to give examples from the evidence that was gathered, and we also give a set of recommendations. These are, however, just a starting point for further discussions. So I've talked to you about the policy recommendations before. We have put the recommendations in four areas. So one of that, we need a dedicated strategic and financial support specifically for projects working on the intersection on culture, health, and well-being. Because if you apply to the cultural funding, then it might not be, if you're helping somebody's health and well-being, that might not be the main objective of the cultural cause. And the same on the health side, if you apply with your cultural project, they will say we have all these other priorities, so why exactly should we be concentrating on this? So therefore, these projects often fell in the middle of the two policy areas and have not been taken up. And this is also what the Culture and Health Platform aims to help to stabilize. Then another recommendation is about knowledge and awareness building. The third one is about training and peer learning, and also about how to localize the culture, health, and well-being research and development policy discussions, as well as, of course, the discussions on an artist level. Because what the Culture and Health Platform tries to do through Creative Europe Platforms funding is to answer to these recommendations, which are highlighted in the slide. So we are providing dedicated financial support to this area, and we are also working on EU level advocacy. Let's say also to bring into the health and the social sectors the cultural point of view and how culture can help in those areas. Another point that we try to tackle is awareness raising of the evidence, as well as training and peer learning and capacity building for artists. And what is, of course, crucial is to have a dedicated platform for exchange. And that's what the Culture and Health Platform is about to be. This platform for exchange at this point is actually mostly for artists, given the funding. But of course, we are also including researchers and other policymakers in some of the discussions. So we have found through actually a series of consultation in the Culture for Health project, which we actually did in 3 locations where we included researchers, practitioners, policymakers, and this is how the policy recommendations came into be. But in those discussions, we have found that there is an uncertainty due to short-term project-by-project interventions in this area. So there is no strategic long-term vision. There is inequitable cooperation across the sectors. So sometimes one sector is at the service of the other sector. There are possibly inadequate and unfair compensation for the artist work. And there is no well-defined responsibility or reporting lines. Who are you actually? If you have a problem as an artist, who should you be consulting? This is what the platform members are helping to do locally to support artists as much as possible in verbalizing their issues and so on, and what could be the possible solutions. There are also a lot of ethical questions in this area, and we also saw that there should be probably a bit of capacity building and training in order to bring everyone up to speed and to the same quality level. There might be a lack of connectivity among artists. We felt that artists working in this area are often alone or in a smaller group, but definitely connecting them across borders, across Europe, is really something that is very beneficial, because it's also nice to learn from each other. Through that way, are also supporting each other in case there are some problems. And we also have seen that, of course, the culture, health, and well-being area is a little bit more advanced in the Nordics as well as in the UK. And we are trying to bring all the knowledge that is already out there to other countries as well. So now I'm starting the Culture and Health Platform presentation in a sense that just to let you know that this is a 4-year project with the objective to support and promote emerging European artists working in the interprofessional space of culture, health, care, and social sectors. What we aim to do is to provide financial support for artist-led projects that bridge culture and health. We support and build artist capacities. We enable their international mobility through connecting them. We increase visibility and of their work and of the artists themselves. And also we provide networking opportunities for them. And the platform will also raise awareness about the vital role of how culture plays in health and well-being. So we will have also targeted webinars for the health professionals in order to kind of raise the demand as well and the understanding of how cultural activities can benefit health and well-being. So as a minimum, 200 artists will be supported during these 4 years, but there will be much more possibilities to connect through capacity building, through online events. And there we have a much higher number, let's say, who will be actually benefiting from the whole action. So we thought to touch, a little bit of what are the important elements of how we understand health, for example. So we are taking the WHO definition of health, which is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So as you see, this is a much wider way of explaining health. And this also means that the projects that we might be supporting also comes from disease prevention and health promotion side, as well as management and treatment of illnesses. So also preventing some kind of difficulties or diseases are also part of the scope. That's very important to emphasize. The main aim is, of course, that the project idea that will be submitted is effective for the health and well-being of a given vulnerable target group or individuals. And also there we have received some questions about what exactly we mean by emerging artist. It's actually quite a broad definition. It's also because the Creative Europe Platforms grant is directed towards emerging artists. And I must say, in the first phase of the platform, so in these 4 years, we want to support those artists who have somewhat I would say they have some experience in working in this field. So we are not targeting at this point artists who just came out from academia, because we feel that first we need to support the ones who are already working there. And maybe in the next phase, we might be supporting also newly arrived artists or newly come artists. So we talk about professional artists who already have some experience in working in the interprofessional space of culture, health, care, and social sector. That means they are emerging as an artist in this specific interprofessional field. So this doesn't mean that, let's say, the emerging artist have to be a young person, for example, or a young artist. It could be that somebody is already an established artist, but maybe you are starting an activity in this interprofessional field right now, or have started for a while. So these people should be artists who have at least 3 years of professional experience if they have a specialized training in his or her field, or have been successful in their specific area, but started to work fully or partly in the culture, health, and care space. And in this way, they identified in this new role as an emerging artist. It's also very important to emphasize that given the funding, only those artists are eligible who are residents or nationals of a participating country to the Creative Europe program. And you can see there a list of the countries who are participating there. So therefore, for example, UK is not eligible, unfortunately. And now I'd like to turn to you this wonderful universe that has been built up. We've been trying to collect organizations who are interested in this interprofessional field of culture, health, and well-being. And this is how the Culture and Health Platform came into being. So it is led by Culture Action Europe. But of course, it could not be happening without these organizations who are 15 in total from 12 countries. And what is also interesting is that the funder specifically asked that every year there is a new platform member added to the platform. So we are, of course, planning to have in year 2, 3, and 4 an additional platform member from another country that would also think about helping to develop the policies in the field in that country. Yes, I'm not going to read them out here, but you can see who are our partners. And what are the platform's actions? So it's also covered a little bit through the objectives, as I mentioned before. But first of all, we will have financial support for projects, and and we will have national level calls because we feel that the artists really need to speak the language of the target group, and also EU level calls. And in the first year, it's a pilot year. So in the first project year, we will only have national level calls for projects in the countries that will be presented soon. And only from 2025, well, actually 2026 February, we will start the EU level calls. Another platform action is to support and build artist capacities through online and live trainings. These will be accessible for all, free of charge. Especially the online trainings with the live trainings. It will also be free for the selected artists. We also have an artist shadowing peer learning program, which is a little bit like residency, but for a shorter period to understand in another country how artists working in this interprofessional field work in another country and bring those learnings back to home. We also will support artist mobility to learn cross-borderly, and this will be for 10 artists per year in 4 years. And our platform members will act as mentoring and supporting organizations in the given country. We will also aim to increase the visibility of this area and showcase the work of artists in one international mega event, as we are saying, per year. And also enable cross-border networking. And here we will be offering online artist roundtables, peer support groups, and also in the 4th year we will build an online artist database so that if an organization would like to contact an artist, then it knows where to find it actually. And we will also offer awareness-raising webinars to the health sectors and the social sectors in order to raise the awareness of what culture can contribute in this area. So now I'd like to give the word to my colleague, Mary Wittig, who is a project assistant at Culture Action Europe, very closely working with me, who will be telling you about what calls are actually open. Thank you so much.
Thank you so much, Cornelia. Fantastic. And I will be sharing my screen as well. Yeah, I'm very happy to pick it up here to provide you with an overview of our planned actions for this year. Um, uh, Here, I would like to start with the national calls. Here you actually again see the map that shows the countries from the platform members. But here, the countries that have a national call this year are marked in green. I have my fingers crossed for you that your country is one of them. The national calls are happening this year from February till March and are calling for projects that are submitted by an emerging European artist working in the interprofessional space of culture, health, care, and social sectors. As circumstances are, of course, quite diverse in all those countries. The calls slightly differ from each other and are adjusted to local needs. Still, all of them have in common that they include a transparent, accountable, independent selection process. And further common elements are that the implementation of the artist project needs to be in the country of the call, that the artist needs to live or be from a creative European country, creative Europe country, that the beneficiaries need to be people in need or at risk. To apply, you need a letter of support from the organization you want to work with, which cannot be from the cultural sector. Instead, it should be from the health, care, social or social sector, or be an NGO which works with specific target groups. Lastly, your project should have the potential for a long-term cooperation. That's really what we're having in mind. And just in case you got disappointed that your country does not offer a national call this year, please just wait until next year when we open our EU-wide call between February and March. Please know that this month the national calls in Italy, the Netherlands, and Austria opened. Apparently, the info session for Italy's call is already over, but Arts for Health Austria is offering an info session on their call on the 26th of February, which is scheduled back to back with a training session that is called From Grassroots Movement to Policy Agenda. So you might be interested in both. Please know that this month the national calls in Slovenia, Finland, Romania, and Malta will follow, even though Malta's call might slip into March. So please follow our homepage there. In April, artists in Sweden should get ready, and in May, it's time for the German, Polish, and Irish national call. For all those calls, please bear in mind that if you're interested, please reach out to our partners directly because they will be able to provide you with much more specific information. Of course, we're always happy to help here from Brussels, from the CAI office, but I think it might be more interesting for you to actually be in touch with local partners. Next, I would like to give you an overview of our planned online capacity buildings. These are available for everyone who wants to sign up and are completely free of charge. Trainings that you find above this line in the middle will be held in English, while capacity buildings below the line will be held in the corresponding language of the organizing organization. Today we're here at the very beginning. In a few minutes we will start our first capacity building on values and principles to think about when to work in the field of arts and health. And our next English training will be on practical guidelines. But I think I should maybe just give you a moment to find the capacity building that fits your language and skills and is of your interest. So below you find all the individual capacity buildings. On our next slide, you see that we also have quite a few on-site capacity buildings planned. Here, I want to point out only 2 examples for now. There is one happening in Lyon on the 31st of March until the 1st of April. It will be in French, and you find the link to sign up in the chat now. And then on the other hand, our second big event will be the showcasing event in Turku in Finland. That's the MIGA event that Kornelia pointed out earlier. It happens by the end of September, which will be followed by the live training session in October, so 1st and 2nd of October. To stay posted here, please have a look at our website during summer and follow us on social media so you won't miss out on any dates. Then lastly, I would like to point out that we will also host 8 artist roundtables. Just as the online trainings, they are available for everyone and free of charge. The idea is here to bring artists working in the intersection of culture, healthcare, education, and social sectors together and provide a platform of exchange. Again, to register, please follow our social media channels and our homepage, as registration will only open a few weeks before the actual event. So that's what we have planned for this year. I will now give the microphone back to Kornelia, who will answer your most pressing questions.
Well, thank you very much. Actually, I've tried to answer everything in the question and answers part of the chat. Basically, what is important, I think there might be some confusion of there are too many websites. I can understand that. So Culture Action Europe's website is our organizational website, and the Culture for Health project is the older website of this old project that I kind of explained already. Currently, most of the information is available on the CultureAndHealth.eu website. So that I think is the most important thing. And yes, the recording, we will make sure that will be put on the website as well. But please give us some time to do that. Okay. Are there any questions that you would like to raise at this point? No. So I think then we can go to the presentation of Italy. So please welcome, just a minute, I'm sharing the screen for you as well. Yes. So please welcome Sofia Sacchini, project manager at Oltre Associazione Culturale, who will be telling you a little bit about this placement opportunity in Bologna.
Hello, everyone. Thank you for inviting me. And today I will present both our association and then this shadowing program we are offering this year. Kornelia, yeah, thank you. So our cultural association is built around some very important core values. These core values gravitate around inclusivity. So we try to make our events and workshops and the more inclusive as possible, in a way that we try to both for people with disabilities, but also we try to make it as much intergenerational as possible. And we do this building our activities onto collaboration. So we really try to put at the center, to place at the center the people that come to our workshop, our events, at the center of Cornelia, sorry, could you go back to the other slide? Thank you. To our events. And we really work onto creativity and expression. We have 2 places in Bologna, Italy, where we structure our activities. We do, as I said, workshops, community parades around the city to reclaim the public spaces for art and performances. And we also do workshops and support programs for artists. So as I say, the workshops that are made to build both the performances, the community parades, they create a sense of empowerment within the people coming because we give them the possibility to structure the workshops. And the last but not least value of our association is sustainability. The association exists since 1998. And since 1998, every activity we do, we really try to put at the center ecology and sustainability of our programs. Every parade is made, let's say, by bicycle. We do not use cars. We try to reuse and recycle everything. So this is a bit about our association. Over the years, we built a strong network of school associations, social services, and citizens around the city, but we also bridge these small communities together with an international network. And then now I will present you a bit our shadowing program that will happen this year. Can I ask you to go to the next slide? So our shadowing opportunity this year will take place between 28th of April and the 20th of May. And this will happen in the occasion of an event we organize almost every year, apart from the COVID years that we had to reschedule it. That is the International Soup Festival, that this is the 14th edition. And the idea is that artists could come to collaborate with our skilled artisans and artists to create visual materials for the festival, such as posters, flyers, scenic backdrops. And this is going to be the occasion to connect with the community, but at the same time to see our artivism and community cooperation artistic network. At the same time, we to see the relational art for mental health and community that we do at the association. The soup festival, as I said, it's why soup? Some people ask us why soup. It is because soup is a great dish that it's possible to find in every culture, in every city, in every context. So the soup is just a pretense to be together, to eat free dish together, and to have workshops of art. So we are going to host 2 artists this year, and the application deadline is April the 6th. You can find more information about the shadowing opportunities in the link that then will be shared. And as I said, we are open to artists that work on visual arts and socially engaged practices. So even if you are not really into visual arts, but if you work with socially engaged practices, there is the opportunity for you to work together with our artists and artisans that celebrate community, art, and cultural exchange. So thank you very much, and I hope to see a lot of you coming to Italy to work with us.
Thank you so much, Sofia, for sharing that. I'm very happy that Magdalena will now present the EU-wide call for artists interested in capacity building for artistic exploration labs. Magdalena Klamminger, is the head of International Artistic Department from Red Noses International. Thank you, Magdalena.
Thank you, Marie, and hello, everybody. Marie, I think we can go on to the next slide. Thank you very much. Before I introduce the Artistic Exploration Lab, which is our contribution to the Arts and Health platform, I just briefly wanted to introduce Red Noses International to those who are not familiar with our organization. We are an artistic organization bringing laughter and joy to people in need of it. We're a healthcare clowning organization that provides 4 programs for different kinds of audiences. We have a big healthcare program. That's where everything started, bringing healthcare clowns to particularly children, but also other people in the healthcare system. We have an older citizens program working with older persons in homes where we find them. We have a crisis response program that is increasingly important, working with forcibly displaced people in camps, for example, in Greece, but also other areas where we find people who are forcibly displaced. And also we have a disability inclusion program. The arts of clowning, how we understand it, is art of connecting. It unites an interdisciplinary form of arts, multiple art forms. And what makes our organization special is that we work with trained clown artists. So it's not volunteers we work with, but we have trained clown artists who have a training of about 600 hours before they're certified at Red Noses, and also they're remunerated for their work. Red Noses is present in 11 countries, mainly in Europe, but also in the Middle East. We have a big outreach, therefore, and work with over 500 professional healthcare clown artists and with over 800 partner institutions where our healthcare clowns go to do their work and reach our audiences. The project that we provide for the our Culture and Health platform, Marie, please to the next slide. The Artistic Exploration Lab, for which the call is now open, is a project that provides opportunities to 12 artists from different performing arts disciplines emerging in the field of culture and health, as Kornelia introduced before, to work together to design and conduct individual artistic research projects. The method that we're working with is participatory action research, meaning that artists do their own research, and the lab will be facilitated by an interdisciplinary team of artists. This time around, we have a dancer with us, a clown artist, obviously, and a theater therapist. The structure of the lab is the following. We will have 2 in-person labs in Vienna, one in June 25 and the closing one in January 26, plus online meetings and mentorship input between to help participants to work on their research project and make sure that they can get most out of it. The theme of the Artistic Exploration Lab is shaping collective spaces and exploring boundaries. And there I would like to go a bit deeper into what these boundaries are. Participants are invited to identify a boundary within their own arts, within their work in health practice that they would like to change, reimagine, or explore. And some examples for those boundaries are lines drawn between, for example, countries, languages, and cultures, genders, artistic disciplines, roles in healthcare, professional versus patient, artists and their audiences, might be artistic organizations, or also boundaries in bodies meeting in space or within one body, and the ultimate boundary between life and death. These are just examples that we would invite people who want to participate to explore. We have a call open now. The deadline is February 28th, so you still have time to apply. Don't be shy. It's not a hard application process. We just invite you to think about what boundaries you would like to explore, what you would like to contribute, and what you would like to get out. So there is still plenty of time, 11 days left to apply for the Artistic Exploration Lab, and we really invite you to apply or share with people who think that might be interesting to you. So we look forward to receive a lot of applications. Thank you.
Yes. Okay. So we thought to move on to. No, first I think there is a bit of question and answers at this point. What I've been seeing in the chat, there is great interest whether there could be a cross-border work as well. For example, going from Belgium towards the Netherlands. If the artist can speak the language of the target group, it is possible to apply to those calls. So of course, cross-border activity is absolutely eligible. However, I'd like to stress that it is also important that the artist is relatively close to the target group in order to have a long-term activity as well. So we see from research that actually you need as a minimum 8 encounters between the artist and the target group. So that actually, as an artist, you need to keep into account if you want to do all that commuting. And we are actually, let's say there is an advantage in the selection process if you're already thinking about long-term work as well with that community. And therefore, of course, it is better if you're relatively close by. But of course, given that Netherlands and the south of Holland is relatively close by, this could absolutely be possible. Then there was another question in the chat regarding the status of the artist, whether it should be self-employed or not. This very much depends on the country. So this, I think, you have to check with with our platform members. But I know that in many countries, of course, the artists are self-employed and so on. But you can also, in many countries, you can put additional income to your tax income if it's below a certain amount per year. So this very much depends on the country, and therefore we would advise you to contact our local partners there. So now we thought to get a little bit of energy for the next part, to give you a little bit of energizer, if you feel like moving a little bit. I think this is the time to start it. After all, we are all about health and well-being. So therefore, I think we can do a little bit of movement. So one of the things that if you would like to do now, is to move your head a little bit, tilting it to the left and right. And then you can turn your head around to get energized. We can roll our shoulders to the back and to the front. And yes, we can stand up a bit as well. And try to reach the ceiling. Get a bit of stretch both to the sides, to the left and the right. And roll your shoulders again while sitting back. Move your spine a bit up and down. And then I think we might be ready for what's coming up. So I'm sharing my screen again. Now we would start to help you a little bit of what it is like to work in the healthcare environment, even if you might have a bit of experience on it. And here I very much look forward to the presentation of Wiltaute Zemelite, head of International Programs Department at Red Noses International, who will tell you what are the experiences of Red Noses, who have been, of course, working quite a lot in this area. And thereafter, we will also have another session by me, also bringing on the activities and the knowledge that has been happening this year. So I'm stopping sharing my screen and I give it over to Wilta then.
Hi everyone. I can't see you unfortunately, but I feel you somehow in the room. So I'm here in order to give you a bit of a teaser, I think, for the trainings that are coming up and then the knowledge that we have in the platform. And thank you very much for Culture Action Europe to kind of asking us to start this capacity building program for you, the ones that are maybe starting or have dipped their toes already in the sectors. And I feel confident in sharing the knowledge from Red Noses International about working in healthcare context. As Magdalena, my colleague, already showed you the slide, but I just want to kind of go through it again. We were working for 30 years already in many countries and building knowledge and tools and methods how to bring arts of clowning for people in very vulnerable situations. And although when we started, that was not really named Arts for Health, we are very happy that this movement is kicking off and this kind of connecting people together. We have already a very rich conversation, very rich discourse about what is needed, how arts is healthy for us humans. Just to repeat a bit, our knowledge is coming from 4 different contexts that we're working in, which mostly is healthcare. Therefore, I'm talking about healthcare today. Also, we work with older citizens in care facilities. Usually, they are there because of the loneliness or of the different medical conditions that they're living with. We work with forcibly displaced people in Europe and beyond, and for different reasons, whether they're migrating because of the war or of the environmental reasons. So this is kind of area that we really feel that arts can make people connect in a more meaningful way and bring emotional well-being for them. And also we work in educational context with people with disabilities, very often children and youth. We work in 11 countries, as I said already, for 30 years, and we work with more than 500 professionally trained artists that dedicate a lot of their time to education, as well as just being in the institutions, learning about them, and knowing exactly the needs of the audiences we're working with. And when we're talking about what we're doing in Red Noses, it's the intersection, it's this moment in between of arts of clowning and social context, and both are equally important. We create art that is designed to address very specific contexts in which we work. So if we're working in healthcare, we really need to know specificity, the language, the needs of the context we're working in. And it's also very important for us to keep the freedom and creativity of artists. So it's really important to see it as an opportunity and as framework, but that we meet, but we are not kind of limited by it. There's a lot of space in between. These are very huge areas of work that connect with each other. So it's very important, the artistic experience and artistic strategy, artistic design, artistic idea that comes into the space that you are very well knowledgeable about, you know it very well. And then we have to know well the issues, the needs, and identify it and address it in the context that we're working in. And these steps of knowing each other are very important, and they can be quite slow, but when you're there, this really kind of opens so many possibilities of the health that art can bring to people. When we're thinking about our approach in healthcare system, we identify several layers that kind of connect and support each other, how we work in the healthcare sector. So our primary audience, like why we exist and why we are doing all of this, are the children and youth in the healthcare sector. And a lot of things happen in the meeting of these children that are experiencing healing process, surgeries, procedures. They are very scary. They can be challenging. They can have long-term impact on their mental health. And we are very aware of all of these things. But we can't work only with the primary audiences. We have a very important part that is the social support systems of the patients, that is their families, their friends, their teachers, all the people that are around the patient on their private level. So we have strategies, and we think very deeply also how to engage them, because when we are gone, these people are carrying on the healing, the art, joy process that we can start in this room, let's say in the hospital. The other part of the audiences that we want to reach, and we do reach, are professionals and volunteers in the hospitals. So we have a separate strategy and separate goals how we want to reach hospital staff. They are, on one hand, the gatekeeper to access to the audiences, but they are also very important human beings in the system that also can experience burnout, stress. They are in need of different skills and connection tools with their patients. And actually, from my experience, they're very, very willing to connect and learn and kind of share the learnings with us. So this is very important part of the system of healthcare. And we also see one important kind of layer that kind of supports everything is building partnerships with institutions and other strategic partners. So that should be the system of healthcare in general. So knowing people in the administration of the hospital, let's say, knowing their goals. What are these people striving for? What is this institution striving for? Also meeting other actors that are playing in the field in your local context. So maybe there is an association of patient rights. Maybe there is doctors association or young doctors association who are still in training. These people are really important to meet. These people will tell you how things work, and these associations will listen to you, and you can find a common ideas and common things to strive for together. I'd like to give you an example how we think in Rednosis in all these layers and how we set our objectives. So as I said, the most important audience group are the children in the hospitals and youth. So we really do everything in our artistic power to bring higher emotional well-being for these children. We're talking about hospitals where children are experiencing very fearful, like challenging, painful, scary procedures. Also, they're super bored. They are cut off from their normal, regular surroundings, friends, family. So we are really looking at the situation they're in, and actually from ward to ward it can be very different. So in long-term patients, they may be experiencing more boredom and isolation. In some acute cases, maybe they're experiencing fear more than boredom. So it's very important to know what is happening and what is what is happening with them in the, and not to have goals that are like, oh, there's like someone who's scared, now I will make them not scared. This is very hard to do, but you can relieve part of the stress. You can bring certain perspective on the situation. So we can't change everything, but we can add to the change that is happening. So that's very important, I think, when talking about hospitals. Then we really try to connect people in the institutions, meaning that there are many children and they are not always reaching out each other kind of because of the circumstances that they are in. So we are trying to make sure to bring the normality of the childhood. It's natural for children to play. It's natural for children to talk to each other and be curious. So as much as it's possible, with the tools that are possible, we are trying to connect everyone that are in the space of the hospital. And then it's also very important that the decisions in the artistic experience is not all made by us. So it's not that we are coming with a ready-made performance and therefore they are just receiving it. It's very important to engage the audiences and make sure that they have some sort of power to decide what is happening, and also making sure that the boundaries, physical and emotional boundaries, are very clear and the child has all the power to control what is happening around them or to them. So this is also something that's very important to consider and kind of set a goal for yourself. When we're talking about change that we want to bring to expanded audiences, meaning family members, caretakers, peers, and professionals, doctors, nurses, anyone, any staff in the medical environment. First of all, we also really want to connect to them and make sure that we are addressing their emotional well-being and create space where they can relax, creating the space where they can play, creating space where they can have a different perspective. Then it's really important for us to have more playful and creative communication skills in the room. So as I said, we have a luxury of coming to hospital and then leaving. Are there all the time. They are experiencing this environment all the time. And the more they are skilled or curious or persuaded about the art's impact on health of their patient, the more sustainable our work is. So we really try to do trainings. We make sure that we make a note of what we're doing. We agree before a procedure. We accompany doctors when they're doing procedures for children. Let's say blood draw. This is my nightmare personally. So there's a lot of fear in the room. So we really make sure that we know exactly what is happening. We know the child before the procedure and we can kind of connect with the child before. And then we support the medical with their process, that it becomes, on one hand, less scary for the child. It's not only our own work, but in general promote opportunities for art, humor, and play to have space in hospitals. I started my work in Lithuania in 2010, and we were so odd in the hospital. It was really a bizarre idea to bring a clown figure in the hospital. And after the first visits, medical staff were taking us by the hand and asking us to go to certain child, to go to certain ward. As an example, for example, there were two boys who were going through rehabilitation process, and they were teenagers and just didn't want to do exercises that would help them heal faster. So our clowns were just going and doing all these things together with them in a funny way, the way that the kids were suggesting. And it opened their block and their kind of protection from this procedure. And it was one of the first victories that we had there, and getting acknowledgement from the medical staff. And then the third level, and I hope some of you will have a chance to do this. I think it's very important, and it's kind of also one of the big goals of this platform is to build you, artists, as our advocates for the mission of arts and health. When we have an opportunity to talk with policymakers, with networks, with all the important people who are making decisions, we really try to advocate for that the artistic activities are integrated in the mental health approaches in healthcare kind of systems. And on the other hand, also to see artistic activities to be accessible and diverse for everyone to experience it. So it's kind of going to the artistic and cultural field that's saying, look, what you're doing is not always fitting to all the people, and please kind of design your activities in a way that it is accessible for everyone. And on the other hand, going to the very hardcore hierarchical places like healthcare, and saying there is space for arts, humor, and playfulness in your system. And with good cooperation, we can do it in a safe, fulfilling, agreed way. And then the third part, and I think that's why the whole platform exists, is that we really want to make sure that the conditions in the healthcare and arts for health are good for the artists. In the end of the day, you are not a social worker. You are not social workers in the healthcare sector. You are still artists in the healthcare sector, and it's important that you have good conditions. You are paid for it. You are involved. You are kind of have enough knowledge about it, and they have time for you to kind of get involved well. So these are just ideas that we live with, and I hope you can get inspired a bit from that. I have also a few tips, like very practical. I hope they're practical tips, also how to work with healthcare sector. So one of the and how to build trust. I think that's very key word, so that you trust the system, that they want you, and they can make your art kind of useful and meaningful also. So not only instrumentalized, but also like in the meaning of arts, like connecting, enriching, inspiring. And on the other hand, it's also something that we need to learn as artists. And this is make sure that you know the rules. There are many, many rules in healthcare. hygiene, safeguarding, rules of conduct. Be proactive in asking about the rules. And if you don't understand part of it, just really ask to be kind of informed well about it. Because for them, it's a common sense. And this will be the crucial mistake, let's say, that you might do that will break the trust with the institution. Also, really helps to know well the routines and main methods of what is happening in the hospital. Maybe one day you can just go and accompany a one day with a nurse or a certain procedure, and just understand deeply and in a human level what is happening with the patient, what is happening with the doctor as well, in the relation to each other, and where can you step in meaningfully in that world. When talking about your artistic approach, it really helps if you also mention audience's needs and interests. So it's not only about the method and the art itself, what you're doing, but it really helps to open their minds and their eyes. If you say, okay, I will be doing this group activity, and this will help your patients to meet each other, create good atmosphere in the ward. It will create certain relaxation and trust in the environment you're working. So sometimes it's not enough to say that we will do, let's say, creative painting workshop. It really helps to also think on the social level what it helps. And what Kornelia mentioned before, all these documents, they have these notes, these things that art can do. So learn the language a bit of the needs of the audiences. Also really ask for feedback. Make sure that you integrate the recommendations. It can be as simple as you are too loud or you are not loud enough in the hospital, or you're coming 15 minutes too early because we have a certain procedure during that time. So just really ask for simple feedback. It can be 5 minutes, and then use this recommendation. And then also there will be more training about safeguarding, but it's about how do we work, how do we make sure that our audiences are safe with us from physical, emotional, verbal abuse. And I think it's very useful to have your own safeguarding or diversity, inclusion, equity statement as an artist. So that's something that I can recommend. If you would want to go through a bit more questions or tips how to build your practice, I can recommend a project called Clonexus. It was about working with autism and dementia, but the fundamental questions and ideas are the same as working in healthcare. So I really recommend checking co-creation map there. And we will be giving more training later in the year, and happy to share these ideas in more detail, in more depth. So I would like to thank you for your time, and I hope this was useful for some of you.
Thank you so much, Violeta, for this excellent overview. We really appreciate your input and how actually Red Noses International collected all inputs from their clown organizations from all around, and tries to make a sense of it, structuring the way you actually just have shown. It's also a result of a series of discussions, I think, and lots of workshop work as well. So now I was thinking to take over from Violeta, also sharing my just a minute. I'll view slideshow. Sharing my screen. Yes. To add on what Violeta was presenting, and I think we on purpose chose to actually work bottom up So first giving an example and then trying to give a little bit of let's say, theory behind it. I will soon present you an interesting framework how working in this interprofessional field has been shown to be beneficial. But first, I just wanted to get back again to the Culture for Health and Well-being compendium, a guide for practitioners. So the ones who are just starting or thinking of starting to work in this field, I really advise you to look at this publication, especially from page 37 on, because it answers to questions like, who should my organization cooperate with? How can my organization reach out for partners? What should my organization take into account when designing a project? This is not about the Culture and Health platform per se, this is in general, but it also can give you a good way to think about projects itself. And again, I'd like to remind you about the Culture for Health database of projects, which is very helpful to check out what others have already done and learn from them. Of course, you can also have the possibility to directly contact those projects and thereby, of course, get into contact with the ones who have been doing it, have a chat with them, and also learn from other people's mistakes and other people's positive outcomes. But what I'd like to bring further, and it's very much also connected to what Vilta was talking about, is what are the actually elements that a successful project in this area need to have. And I was very grateful to find this creative health quality framework and 8 principles developed only in 2022 on the website. And of course, we will drop the link to the chat as well. It was developed by Culture, Health and Wellbeing Alliance in the UK, together with James Willis, consultant. And it's actually an outcome of working in 7 workshops with 150 people. Of course, working in this area, and they together got together and put this framework together because everybody would like, of course, to have a successful, well-working project, not only successful, but what is beneficial for the health and well-being of the people. So these 8 principles are actually that these projects should be person-centered. They should value lived experience and enable the potential of the people. They also say it should be equitable, so it should be working toward a more just and equitable society. That is also meaning that, for example, if you have, for example, dance sessions which are paid by the beneficiaries, you could also think of how you can find some funding to support some of the people who cannot afford to pay those. It should also be it's very important to have these projects that are safe. We should be very clear that we should do no harm to the beneficiaries and ensure their safety. And you should also think about how to manage risks. Another element is creativity, of course. So these projects should engage, inspire, and ignite change. It's also very important to work in collaboration, much what Vilta was talking about. You need to find a partner and work with others to develop a joint approaches, also understanding what their concerns is, and also them understanding what you can contribute in such kind of relationship. It's also very important actually to be realistic. You have to be realistic depending on the funding there is also available, and also about what you can actually achieve during this time. So we shouldn't overpromise anybody what you will be achieving. But a super important quality is actually being reflective. If something doesn't work, are you open to change it? Are you actually realizing that that maybe some things have to be different. So reflective, evaluate and learn from your own mistakes, and ideally from other people's mistakes beforehand. And that's very much what the platform is about sustainability, that we should work towards a positive long-term legacy for the people and the planet. So this can also mean of like how they can still remember the effects of the project you had. If you're a visual artist, is there something they can take home to make them remember about the good feeling and so on, but also in terms of the project sustainability per se, of is it possible to find funding for longer term, and that's very much what the project, the platform aims to do, with asking letters of support from external organizations, because if they already committed beforehand, they might want to, if they see that there is so much benefit that through your artistic work you can give, then maybe they can consider to partially finance longer term. And another part of the framework is actually the quality cycle. You might have seen this before, of course, how you first develop the concept, the proposal, and aims and approaches of your work. And then the next step is, of course, building strong foundations, developing policies, processes, structures, briefs, and contracts for the work, making detailed plans, developing detailed work plans, programs, and budgets. And the next part is about delivering actually the work. So there has been a lot happening beforehand, devising and delivering creative groups, workshops, and activities. And you also should make sure that you learn from that work, also reflecting what has happened, what could be changed, evaluating it, and learning from the work. And what actually this creative health quality framework is doing is it puts the 8 principles according to the quality framework stages. Of course, I'm not going to present you everything, but you can see in the developing idea phase, what exactly does it mean to be person-centered? And it gives you a set of things to consider. And this is why I think it's very helpful to give you ideas of what really you need to cover. And it's good to learn from people who have already done it. Again, this is a result of 150 creative professionals working in this area. So I think it's good to consider working with it. I also wanted to highlight another publication that is, again, free of charge online, where actually this was developed in Finland when they wanted to develop a 2-year university course for people in the interprofessional space of culture, health, and social sectors. And they wanted to understand what exactly they should be teaching in this course for those practitioners. So they have kind of highlighted what are the competencies that are needed in this field. There is, of course, the field-specific competence of like what you do as the artist. But again, here comes again the reflective competence. What did I learn? The social competence, because not every artist is actually fitting and both qualified and also personality-wise might not be fitting working in this area. So this really has to be considered in order to do no harm. Other competencies are creativity competence, multi-professional working competence, meaning how you can work with the other sectors, sustainability competence, how you can make sure that it's on a long term, emotional competence, and ethical competence as well. I'm not going to go into details, but this publication, and again, you will receive the link in the chat, this publication kind of describes all these competences. And one anecdote at one of such seminars, I was presenting these competencies, and many artists got like afraid, like, oh my God, am I am I sure that I'm ticking all the boxes? That's not really the aim, but of course we should work towards that. So please don't be frightened about all these competences, but it's a good to consider that really, as I say, there are some artists who have the qualities and competences working in this who would be fit for this job. Yes, I think now we can stop at this point, and I'm going to check if there are any questions so far. I see 3 questions. I don't think the health quality framework available in yet. Okay, then I think most of the questions were answered so far. Well, then I think there is nothing more left to do, is to let you know that how to keep in contact with us. So again, if it's about the national calls specifically that are open, please contact our local platform member. But of course, Mari and myself, we are very happy to answer also your questions. I think it's quite good if you share whatever project you have been doing in this area in the Culture for Health project database. It also gives visibility, but also helps others. We would propose you to subscribe to our Culture for Health newsletter. So far, that's what we are using still from the previous project, but we will be also starting a Culture and Health newsletter soon. And don't forget to follow us on social media. And I specifically say that the Culture for Health LinkedIn post is the best to follow, because that's where we have most of the information. But of course, Facebook as well. We have already put the Culture and Health Platform website in the chat. As you see, it is still in the making. It is basically a one page there. We will come up with a much more specific and specialized website. But so far, we thought it's most important is to get the information out there. So this is currently a landing page. But if you click down, always those pluses, there are much more information below them. Yes, what else? Well, in that sense, it's incredible. It's 1:28. We have reached the end of our seminar. You can find my email there. It's Kornelia at Culture Action Europe and Mari at Culture Action Europe if you'd like to keep on talking to us. And I think it is now time to say goodbye, unless there are some further questions in the chat. We see that there are some people who put there that they would like to receive the links as well, and we can email them to that. Okay. Well, I think then I really appreciate that so many have followed us. Please keep contact with us. We will soon launch these artist roundtables as well, where we can meet in smaller groups and talk about each other's project and experiences working in this field. So we are very much looking forward to this 4-year-long journey in the coming months. Thank you very much.